Good afternoon, guys. Today we are going to discuss about atrial abnormality. Previously, it is also called as enlargement, but that term has been discarded now because that atrial abnormality can be because of many things like enlargement, like atrial hypertrophy, and it can be because of increased pressure also. So we will cover this thing under two because there are two atrium, left atrium and right atrium. So first in this module we will discuss about left atrial enlargement or abnormalities. Now what are the features? Now remember basic concept of P wave. I have already discussed in previous module that you have to see lead 2, lead V1 and frontal axis for any atrial abnormality to be described. So let's start with those basic concepts in our mind. Now first is prolongation and delay of the left atrial component of atrial activation. Now what is the left atrial component in the lead 2 and V1? In V both are its terminal component. So I have already made a diagram. In lead 2 you will see here this kind of ECG. Okay, so what are the features of left atrial enlargement in lead 2 is double peaked, then notched, and you will also call this camel hump. Now what is important? The distance between these notch is more than or equal to 0.04 second or P wave duration more than 110 millisecond is considered as left atrial abnormality lead 2. The one important thing here, if you see, that is left axis deviation of P wave is also going to be happen in left atrial enlargement, because when I will show you the diagram, it is an enlargement of the left atrium. So you see the vector will also increase, and left atrium is situated posteriorly to the right atrium and it is more towards the posterior. So net vector will result in the left axis deviation. So in those cases, the leads which are CE, you can also see best in AVL in case of left atrial deviation. Second point or criteria is increased posterior deviation of left atrial vector. Now, increased posterior left atrial vector. What is the left atrial vector? It is a terminal component in V1, that is a negative. So what are the features you will see? First of all, this atrial activation is prolonged. Second, there is a decreased in magnitude. P wave down will be going to be low, directed further posterior, as I have already explained you in the diagram. So basically you will get this picture, which is deep, delayed, widened terminal component. You see, this is widened. Now remember one thing, there's something called Morris index, and you guys need to know, especially the medicos who are seeing this thing. Now, what is Morris index? It consider your duration of at isoelectric line of negative deflection of P wave upon the depth. It is a product of it. So you see the diagram, depth into duration. So that is a Morris index. You just remember the value. If it is more than 0.03 millimeter per second, it shows left atrial abnormality. What is the third? There is a left axis deviation on the frontal leads manifested in P wave. You remember this thing, as there is an enlargement. I have already explained why. This is also one of the criteria. So basically the axis, the angle is normal angle is plus 40 degree. So it is beyond 0 to 40 is going to be happen in P wave axis. Now what is the clinical condition which are important here? Systemic hypertension. Left atrial abnormality in ECG is one of the earliest signs you will get for the systemic hypertension. So guys, don't say ECG is just normal without commenting on the P wave. Look for it before coming strain pattern or any other sign of hypertension. It will be there. Second is acute pulmonary edema transient. It will also come in acute pulmonary edema cases. Third, which is very important, that is in case of left bundle branch block, it is the only sign of left ventricular hypertrophy. It's a very concept thing. So guys, now here I will end this discussion about left atrial abnormality. So you now know how to see for it. Thank you.